With rising fentanyl overdoses locally, Travis County is taking another step to help keep people alive.
Yes, and they're targeting the downtown Austin bar scene. Today, county officials announced they will pair up with Safe Haven Harm Reduction to train bartenders and get Narcan into local bars. Narcan is an overdose reversal treatment that is administered as a nasal spray. It has no negative side effects if used on someone not experiencing an overdose. Several bars in Travis County, including Star Bar on 6th Street, will get the training and the doses of Narcan.
We certainly understand, especially today on a national level, the staffing shortages we're seeing within APD and county and city emergency services. Any bridge that we can provide to extend that lifeline and hopefully get the emergency services here faster through the use of Narcan, we're more than happy to help with.
Travis County will vote during its session tomorrow on $350,000 in funding for overdose prevention, half of that just for Narcan. Going in depth, Narcan wasn't the only solution Travis County floated today.
It's also putting pressure on state legislators to make changes to Texas laws. KXAN's Grace Reeder dives into a 2021 law that local groups want watered down.
It affects families all across Travis County, and it affects us.
More people are dying from fentanyl-related overdoses in Travis County than ever before. New data shows we could see double the number this year compared to last, and those numbers are proportionally worse for women and people of color.
So the data is clear. Fentanyl does not discriminate. It can impact, and it is impacting all of us.
While the county came forward with local solutions Monday, they also want the people in this building to help out during the legislative session. One of the ways by loosening the rules surrounding our Good Samaritan law.
Our Good Samaritan bill is garbage. It needs to be covered for everybody, not just the limited amount of support that they give to people who call one time.
Last year, Texas lawmakers passed that measure and the governor signed it into law. It protects some people from getting in trouble if they call 911 and have a small amount of illegal drugs or drug paraphernalia on them. But the law notably only protects people without a previous drug offense and people who haven't called 911 for medical assistance in the past 18 months.
There are restrictions in that law that make it difficult in communities all across the state. But here in Travis County, I want to be clear that regardless of the law, we will not prosecute people who call 911 to report an overdose.
Even so, the director of Safe Haven Harm Reduction says people are often too scared to call 911, and without widespread protection, they won't.
Why would somebody want to call 911? And so, you know, I get asked a lot, like, where are the hot spots? And it's like, how would we know?
Grace Reeder, KXAN News.
And earlier this year, we told you about an Austin man charged with felony tampering with evidence after he allegedly failed to call 911 during an overdose at Victory Grill in East Austin. One person died. Well, court documents show the district attorney dismissed that man's case due to a lack of evidence.
Now here at KXAN, we have profiled fentanyl testing strips before. They cost about $2 a piece, and they can let a person know if fentanyl is mixed with some other drug. But these testing strips are classified under Texas law as drug paraphernalia, making them illegal here. State Representative James Tallarico of Austin filed a bill for the upcoming legislative session to decriminalize these testing strips.